Hey everybody, welcome to the next episode of the Dose Adjustment Podcast. My name is
What we're doing today is kind of a Q&A that
and in those ways I'm different than your typical pharmacist, but prescription therapies and supplements are currently part of your personal healthcare stack.
The information provided in this podcast is for educational and informational purposes only, and it does not establish a physician-patient or pharmacist-patient relationship. The opinions expressed by the hosts and guests are their own and do not constitute medical advice. This content is not intended to diagnose, treat, cure, or prevent any medical condition. Always consult with a licensed healthcare provider in your area before making any changes to your personal healthcare regimen or acting on any medical information shared in this podcast.
Hey everybody, welcome to the next episode of the Dose Adjustment Podcast. My name is Amir, it's my co-host Kris. We are happy to be back with you today. If you're new to the podcast, just a little bit of background on me. I am a pharmacist. I own 2 pharmacies here on the Treasure Coast in Florida, and I'll let Kris give his own introduction.
Yeah, I'm Kris Hasnauer. I'm a physician assistant. I own Emerald Medical and T1RX and a bunch of other things, and we do lots and lots of, everything that's to do with men's health. What we're doing today is kind of a Q&A that has come out from a lot of our, I would say a lot. I wish we had a lot, but maybe you click and like and subscribe and we get a lot more. But Q&A from different patients and customers that have come up with their questions based on our previous episodes.
Yeah, so I really tried to compile them all from, I think there's seven or 8 episodes out right now on different platforms. We had some questions come in that way. We've also done a lot of shorts on YouTube and then on your social media, my social media, and then stuff that's come into the store, as a reaction to the different type of stuff that we've done. So I've got a pretty good list. There were probably 30 questions. I tried to combine as much as I could and put it on the list today. But before we do that, I had a bit of an episode last week. So we'll tell people a little bit about that, how that went. So, this year I'm coaching Little League Baseball for the first time with my son. Played Little League Baseball, played a lot of softball. Never coached baseball before, but my son was in this in-between stage between going to like what they call AAA ball or the majors, right? So he talked to his previous coach who wasn't coaching in the fall. And he's like, I think you should definitely go to the majors. You should do it. Step out of your comfort zone. It's the fall. It's a little less competitive. And he was on the fence. So I said, I'll coach. What will you do it if I coach, right? So try to do the good dad thing. And so anyways, I'm out there running practices. I'm watching all the videos that I can from like seasoned baseball coaches. Like, hey, what do you do during a baseball practice?
Where do you stand?
What are the drills? And luckily, where do you stand? Get into that. Luckily, I had a bunch of great assistant coaches and some guys that even played college ball, been coaching, all throughout the year. And they just, for whatever reason, had commitments. They couldn't step up to be a head coach. So nonetheless, fast forward, we're 3 or 4 practices in, and we're doing live batting practice, right? So they're pitching in the ball. And essentially, if a batter, gets a hit, great. The team fields it as they should. If not, I step up and I'll hit a ball. And so I'm trying to keep all the kids engaged, pay attention, play like it's a game, practice perfect, play perfect, all that stuff, right? And I'm looking at my son in the outfield, like, hey, Braden, get up there, pay attention. And out of nowhere, 60 pitches, my batter hasn't hit yet. It's 60 pitches, I swear, he's not hit a ball yet. Out of nowhere, he hits a foul ball about 6 feet from me. And I had stepped up closer, to the batting boxes. I'm yelling at the team to get ready and look out for the ball. And so I caught a baseball right in the nose, and we'll probably add a picture of it at the baseball field. It was pretty
epic,
pretty gnarly. So, of course, my wife, who kind of runs my world, is at almost every practice. She has a Gorilla Medical Mama Trauma kit in her baseball bag, specifically for instances like this. Of course, we got overlapping football practice. She's not there. So I did the best I could. We got some rags, we got some ice, did all the typical things. Did my very best to pinch it off, right? Elevate and pinch off. Hurt like hell. So couldn't do a lot of pinching. And it stopped. It was in about 5 minutes, 6 minutes. I think it was the adrenaline. I literally finished practice. I was running bases, simulating stuff for the kiddos. No problem at all. An hour later, situation changes. I'm picking my kids up from another event. I start bleeding, and I mean 20 ounces of blood, if I was estimating it, could not get it to stop. It was straight run. I was making a mess everywhere. The church kind of looked like a murder scene that happened. And finally, laying on the grass, pinching it, elevating it, stuffing everything I could up there, got it under control, got home, thought it was fine.
Mm-hmm.
Coming to the podcast. And here's the thing, we delayed the podcast by a week for this. So I have dinner, Indian, I think. I don't really remember anymore. I don't remember a lot about that night now. But get home, have dinner, everything's good, starts bleeding again, cannot get it to stop. The entire shower basin is filled with blood multiple times. I got my larger Gorilla Medical kit. I got the gauze out of it. I got the Afrin out of it. I'm soaking it. I'm spraying it. I'm squirting it. I'm a pharmacist. I've got a great kit here. I should be able to take care of this. This is ridiculous. Time goes on, clean the shower out, fill the shower with blood again, starting to get a little dizzy, a little woozy.
Yeah.
Right. At this point, I'm estimating, and I'm just estimating, right? We didn't measure anything. I gotta be coming up, and you tell me if I'm wrong, but a liter of blood. If I think of a liter bottle, I left at least that much blood.
So you absolutely, and I'd say a little more because, we'll fast forward to a little bit. But so I get a phone call about 11 o'clock.
Yeah.
And it's like, hey, we can't get this stopped. What should we do? And I was like, all right, let me come down there and look at it. I don't want you to have to go to the ER if you don't have to. Bro, when I got there, you were basically in the first stage of shock. Like you were not just like had lost a little bit of blood. So when you lose blood, obviously you go donate blood. That's a unit, 500 mLs.
Yep.
2 units, you started to have a little problem. 3 units, you started to look at what you lost. I'd say you lost more than a liter by the time I got there because you were pale. Your heart rate, when I checked you, your heart rate was like 146.
Yeah, it was
high. It was tacky.
Yep.
And you were white. You're pretty dark-skinned dude, you were like white, like me white. So I was like, okay, we probably should do this. So, and then when I pulled the gauze out, your nose just kind of erupted everywhere again. I was like, we got to go to the hospital. So luckily, got it stopped.
Bleed was pretty far posterior. So even Kris, a master packer here, it just, when we plugged both sides up, it would just run out the throat and cough it out, all that stuff. Ultimately, Kris ended up driving me to the ER, went in there, got a CT scan, the nose was broken. But ironically, Kris's packing job actually worked.
Yeah.
They didn't actually do any intervention other than give me 1,000 mLs of fluids IV. There was no other intervention that they actually gave me at the ER unit. So, anyways, Gorilla Medical, their kit saved the day. And then one thing, I think with Kris and Emerald Medical that we don't talk a lot about on the podcast, but even from the early days before we were really close. And I don't remember what the situation was. I think my son Max had cut his chin open. Yeah, and so my wife and his wife, known each other from homeschool, I think, or jiu-jitsu or something, and she had called him up, and Kris just literally zoomed over to the house, just like he did that night, stitched him up. I don't think Max likes you still.
No, he does not. No, we're not
to this
friends.
Day. So we wrapped him in a towel, right? So Kris is technically wrap him in a towel so he can't, move around, sit on him and hold his head. And he literally stitched his chin up. But just one thing that I think we don't give you personally and Emerald enough credit for is just the level of attention that you give patients, especially, and I know it's not just my family because I hear this from other patients as well, but, and even the next day, it's like, I remember even with Max or when you're treating Braden for dermatitis, whatever it is, like Kris will call you the next day, or somebody from the office calls you the next day. And I just remember how rare that was. But I appreciate the hell out of you coming down, helping me out,
Of course.
It's good to have a brother. So
yeah, it was good stuff, man.
So hey, I got you something.
Oh,
all right. A little thank you gift from me. So go ahead and open that up. While he's doing that, we are making a few adjustments to the Gorilla kits and putting some of those Rhino rockets in there, which would have been the intervention at the hospital had we done that. So this is the world's, it slides off the end.
Okay.
It is the world's most premium vitamin case.
Hell yeah.
Custom inscribed with a T1RX logo.
Thank you.
I got a couple of these this year. They're pretty cool, but figure you got to have the most premium swag,
Thank you,
best
brother.
supplements in the world.
Absolutely.
So, with all that said, that was my ordeal. I'm healing pretty well. Podcasts are delayed by a week. We apologize on that. But let's get into this Q&A today. So, number one, and there's not a lot of context around some of these, especially when they come in online. So, we're going to talk about a study here. We have no idea the name of the study, but nonetheless. Number one, there was a recent study published showing potential anti-aging effects of vitamin D. Are you familiar with it? what does the evidence actually say, and what general recommendations do you give your patients on vitamin D?
All right, vitamin D kind of goes like this. Studies, one thing for studies. New England Journal of Medicine and JAMA. Basically, if they're not coming out of those, they're probably pay for play. Almost everybody. Medical studies are that. Vitamin D. If vitamin D was discovered today, it would be a hormone, not a vitamin. Mm-hmm. You know, it is that.
Which is how I even describe it.
Yeah, it is that imperative to like every biological process. So as far as the anti-aging stuff, vitamin D is involved in the maintenance of DNA. So the idea that, using vitamin D can maintain or decrease telomere degradation. So telomeres are like the ends of your DNA. So it's like a copy of a copy of a copy. Every time a cell divides, the DNA gets shorter, shorter, and shorter. So it basically is more toner for your copier.
Yeah.
Right. You're just keeping it up on toner so you can make better copies over and over. That's what it's doing there. But it does a lot of other stuff too. I mean, you need vitamin D for pretty much, I don't know, so many biological processes, metabolism, cardiovascular health, like immune system, all these different things. Yeah. Vitamin D is the precursor to testosterone.
Yep.
So you need that DHEA and vitamin D and the balance of those things. So short version, yes, take vitamin D. Thousands and thousands of labs I've drawn on patients at this point. Probably fingers and toes could count normal vitamin D levels I've pulled on a patient.
Yeah.
Like of just like straight labs. Nobody has normal vitamin D. If they do come in and they have normal vitamin D, they're on a supplement.
Yep.
Whether that's sunscreen, whether it's our lack of getting in the sun, whatever you want, whatever it may be, we just don't have it. Vitamin D between 25 and 85, 90. Mm-hmm. The closer you are to 80s, if you can get your vitamin D up that high, you feel better. Period.
And you're seeing lab values in the 13s to 20s, 25s. What do you see?
Yeah, sub 20s. Like pulled one today. Somebody that a patient that you would thought, a very athletic person. They lab value 9.
Yeah,
almost nothing. Like not detectable. And some of it, just get the less than mark. It's like we can't find any, and it's just because either they're not processing it, they're not taking it. We don't really get it in our diet unless we, what do we get? Fortified milk.
Yeah.
Mushrooms. But
I don't even eat mushrooms.
Exactly. So people don't eat it. So it's like, what are you getting it in? So
yeah. And if you, I think the second part may have been around a recommendation when it comes to dosing with vitamin D. So if you have lab work, mm-hmm. that's the most amazing thing, right? And then somebody like Kris, your primary care doctor, they can make a very detailed recommendation based on your weight and based on your lab marker. Mm-hmm. If you're trying to supplement vitamin D and you don't have that data in hand, I think anywhere from 1,000 to 2,000 units a day minimum would be your good start place.
I basically start everybody at 5. If you see me, I'm like, go take 5,000 units a day.
So yeah, and I was in that 5,000 camp for a long time, especially if you're taking a pill form, because you got to eat it with a fatty meal. Mm-hmm. You got to really hope that a portion of it gets turned into chylomicron in the gut and actually gets absorbed. A lot of individuals have switched over to the Micellized brand, mm-hmm. which we sell through T1RX. It's a combination of vitamin D3 and K2. And so Micellized is a really fancy term for it makes it water soluble, right? So it actually absorbs right out of the stomach. So if you think how quickly alcohol absorbs from your stomach and hits your brain, mm-hmm. this helps vitamin D to do the same thing.
Absolutely.
Vitamin D in its natural state, very fat soluble, got to eat a fatty meal with it. It doesn't go with the lifestyle of a lot of guys who are getting after it and fasting and whatnot. So take a micellized form, you can actually reduce your dose and really impact your levels.
And your best. Absolutely, because what we're talking about is like supplementation. If you're not getting it in your diet, we got a buddy of mine, Mark, is over here. He's sitting off screen a little bit, but Mark's a farmer, and we've been talking about this at length for the last 2 weeks because he's giving me a lot of shit for my diet, even though I try to clean it. My diet is way better than it was, but it's still not perfect. So that is absolutely the thing. I mean, when you're eating clean, when you're eating healthy, you feel a difference. Yeah. And when you feel like you're getting these things, but all the supplementation is like, okay, I'm not getting it through my diet, or in the things I am eating, the place that I live, it's not available, right? Like, something simple as stupid as scurvy, right? Like citrus fruit or liver. Yeah. Right. That's where you're getting your vitamin C from. So it just depends on where you are in the world as to how you're getting that set up.
No, absolutely. So vitamin D, we're very pro on. I can't think of a patient yet where we don't recommend it in, especially if you have lab work and biomarkers.
Well, here's the thing, is then I find this incredibly interesting. And this is kind of goes back to my big pharma, well care, sick care, whatever thing. They won't pay Medicare, Medicaid, Medicare will not pay for vitamin D tests anymore. Won't pay for it. Because when you put people on vitamin D, they feel better.
We see a trend in the pharmacy space too, where when we're trying to put vitamin D through insurance, a lot of insurance companies are rejecting it now, which isn't the end of the world because they don't pay anything anyways. But conversation for another day.
Yeah.
Anyways, very pro vitamin D. This is the vitamin D3 K2 that we sell through T1RX. It's what I take personally. I know it's what Kris takes personally, and a majority of patients. That come to most of our practices and other practices as well. Best version you can get, no doubt. All right, next question. Kind of a loaded one here. Let's see how we approach this one. Neither one of you seem like a typical pharmacist or PA. What motivates you to approach situations differently than many of your peers? And do you feel that your patients actually have any better outcomes as a result of it? So you want me to kick it off for you?
I'll go with this one. Why am I not too? Because I decided a while ago that I was going to set up medicine to be more of it, to be my own boss. Like my medical director is a partner and he's super intelligent and all that, but it's like kind of what you're saying about doing house calls and doing things. Like corporate medicine doesn't support that.
Right.
And that's what it is. It's like there's a better way. And if your patient population has to be smaller, so be it. Because eventually if you're treating everyone one way, you're not really treating anyone the best way.
Yeah, 100% agree. Yeah, and I think from my perspective, I spent 17 years with one of the world's largest pharmacy chains, right, who claim to be devoted to health and wellness. And what I recognized being on the other side of the curtain and just seeing what was actually important to that company, it had nothing to do with health and wellness. So it was sell as many pills as you can, add as many pills on as you can, to the point where they would have us call prescribers and say, hey, don't you think the patient ought to be on this or that because they're on this condition or because they're on that medication? They would sell the cure and the disease. So in the pharmacy department, they would have us push as many pills as we could, as many immunizations as we could. And I'm not saying that any of that is bad. I'll get to pills and immunizations and all that, but that's wasn't what it was about for the company, right? And then on the front end, right, I got some time as a store manager and as district manager. They wanted us to push alcohol and cigarettes and candy sales and digital sales and whatever else we could do. And so it never really aligned with me inside. And I always tried to buck the system at these places. And because there's not a ton of oversight, you could do a lot of what you wanted to do and practice how you wanted to practice. And because of that, I became very popular. And I even got promoted because of popularity with patients. But same thing, I want to step out, be my own boss, practice the way that I want to practice. And in those ways, I'm different than your typical pharmacist. But in 60 or 70% of the ways, I'm still the same, right? You got a runny nose, get allergies. I'm going to make a really good recommendation like every other pharmacist in the country.
And that's exactly, it's not that we're not reinventing the wheel. It's the delivery mechanism.
Yep.
Like we're going after it. We're looking at it. I think we critically work through the things and the issues and we're like, okay, well, this is my opinion on it. Because there's a lot of stuff in here that like science is a back and forth of a hypothesis, test, retest. And that's it. None of it's gospel. They're going to find out whatever, like, they're going to be like, well, why did you do that, 50 years ago? Because it's poison. We didn't know that. It's like, no, we didn't. But that's just how it works. And there's all of these different things that come into play with each individual patient. I kind of look at it from, like I said, coming out of SF and coming out of team of medicine. You're never going to be as close to a group of people as you are to your SF team when you're doing these things. You have to know them inside and out because you are going into some crazy shit together that you just have to know. Well, that relationship, that brutally honest relationship with those guys gets results. So if you can have that relationship with your patients, which is ideal. And like for me, I don't want it to be intimidating. I mean, I hate going to the doctor. The guy sit there at his certain tie. And he's like, oh, I hate that. And I understand what he's saying.
Yep. Yep. No, I'm with you. And I think the approach at both of it, at least behind the scenes when we talk about patients and whatnot, is there's a bit of a preventative approach. Right.
Absolutely.
And we don't always see that in medicine. It's like, okay, there's a treatment algorithm. If your cholesterol is this, and you're going to take that. And if you don't respond to that, we're going to add that on. And if your blood pressure is high, we're also going to add that on. And as you get fatter and sicker, then we're going to go ahead and get this put on and that put on. And then we'll get you PT therapy to help you walk a little bit longer. And there's just like a progression of disease state until you die. And what I think we both share a passion around is like, how do we either prevent that stuff from ever happening, right? Or if we're in the early stages, how do you have a really honest conversation about how we're going to turn it around?
Yeah.
Right. Medicine's got its place, but there's also that coaching and directing of how do we reduce that dose, right? And reduce. And maybe we get you off of that.
Because we both see it. Everybody sees it. You see people that end up on this polypharm cocktail of things. They're like, oh, you're this old. You need to do this now. It's like, well, do you? Like maybe we should do anything we can not to end up there.
Yeah, 100%. And then as far as patients, like, do we see our patient population is actually, any better, any healthier? I'll say in the last 4 years, getting to work, in a private compounding pharmacy where we do a lot of HRT. This is one of my favorite segments of people to work with, right? And we work with HRT patients, traditional pharmacy patients, with hospice patients, with people in facilities. So I work with a lot of different segments. But the HRT population in particular is like, they're actually clients that you feel better when you leave. They are getting the most out of life. They're enjoying life. They come in, they're not sick. They're excited to see you. They're happy to get their medication and not in an opioid, sort of way. And it's like you actually get some job satisfaction out of helping people live their life to the fullest.
For me, that's the whole purpose of like what I'm doing. Because I have been like God's own train wreck, right? Like I've been there. So I see these patients and I see the improvements. It's not, do I have all the answers? No. Do I have a good portion of them that I can get you in the right direction or help you? Absolutely. Yeah. And obviously I'm like, well, this is what's helping me. And this is where I'm at, for whether it's HRT, whether it's supplements, whether it's ketamine therapy, whether it's just diet, exercise, whether it's behavioral health therapy. Like, it's like all this stuff is a part of it, like it's a whole system.
Yep.
So.
And I had one of your patients the other day. I've heard this a couple times over the past year now. It's actually a new patient to you. And he's starting HRT therapy, and I'm like, hey, what's going on? Or why'd you go decide to see Kris or whatever? He goes, he's like, I know him. He's like, I want to look like him. I just want whatever he's doing, I want to do it, And so, you definitely, walk the walk, and I think a lot of your patients appreciate that. They see you as a role model for what their life can become. So that's pretty awesome.
Very much on the M&M thing. Do not use me as a role model, but but I will help you do what you need
from
to do.
From an external physical appearance.
Do not.
All right, very good. I think we hit that one pretty good. All right, this one is directly for you. It says, Kris, I've heard you talk about using ketamine therapy for PTSD. Can you give us some background on what the process involves? What are the risks and the benefits if a patient is considering it?
Okay, this will be a short version of what could be its own episode. But so ketamine, everybody's heard about it. It's in the news, whether you're in college in the 90s or even now, as a party drug, it is what it is. So here's the deal with any medication. I don't care what it is. You can abuse anything. Doesn't matter what it is. Then if you use medications for their intended purpose, lowest possible dose to get the desired end state is what every medication should be about. That's it. So ketamine therapy. It is a dissociative anesthetic that is a very old drug, like World War II, Korea era, chemical patents on it. It is used for surgery in high doses, right? So what does it do well? Well, when you do surgery on someone, you want a few different things. You want pain control, amnesia, and muscle relaxation. Ketamine is great for pain control and amnesia. Does not do muscle relaxation. Therefore, its safety profile is higher, but it's not, like if your muscles aren't relaxed, I'm trying to cut on you and they're spasming or reacting, that's not good for the surgeon.
Yeah.
Very safe in children because when it doesn't have muscle relaxation, there's no respiratory suppression.
Okay.
Right? Your respiratory drive doesn't suppress. So then you look at that. So that's what the drug was designed for. Well, in the mid 2000s, U.S. Special Operations Command started using ketamine for pain control on the battlefield in lieu of fentanyl. And we found out that people that got ketamine did not have as bad of PTSD from whatever horrific event that happened to them.
Yep.
Like lose a leg, lose an arm, whatever. They didn't have that.
And when you gave it to them on the battlefield, would it put them lights out?
Yeah, I mean, we were snowing them for pain control purposes. So at a higher dose, like sub anesthesia, but using it as pain control, right? Yep. So, retrospectively, I look at that and I'm like, okay, what's going on this? And some other people had figured it out before. I mean, they were, this wasn't like some, oh gosh, we figured this out, but there's some other studies on it. So like, oh, there's something to this. So in that state, that disassociative state, okay, this is less. So what can we do? Is the inverse true? Can we do something with this? Mm-hmm. And it turns out you can in lower doses. So, you figure a surgical dose is about 500 milligrams, not to snow somebody or whatever, right? You're given maybe 50 milligrams. And when we would so if we were going to reset a femur, for example, say a 3-year-old comes in with a broken femur, we're going to give them triple the dose that we're going to give an adult for behavioral health purposes over 1 minute to pop the whatever back in. And this behavioral health dose is slow, gradual over an IV in a controlled setting, whatever. Now, what is happening to your brain? All behavioral health is about neuroplasticity. Don't care what it is. And ketamine makes your brain hyperneuroplastic. Mm-hmm. The psychedelic effect is kind of like the Bob Ross thing. It's really just a happy side effect because the neuroplasticity lasts after. Okay. So if you do the therapy and then you do behavioral health treatment with it, you will improve your outcomes. Transiently, it reduces PTSD, anxiety symptoms from a lot of chemical reactions like glutamate and GABA, which are neurotransmitters. Glutamate's excitatory, GABA calms you down. Basically, ketamine knocks all the glutamate off the branches, so your brain gets hyperexcited, hyperneuroplastic, and then GABA is running unopposed, so you're super calm. And because the glutamate is the top of that cascade, it dumps a lot of serotonin, dopamine, or happy chemicals in your brain. So you have this calming, transient antidepressant effect. Then we use therapy to teach you to keep your brain there.
So when you say use therapy to teach us to keep, what is that? What is the therapy
Talk
actually?
therapy.
Tell me through that.
Talk therapy.
Okay.
So when you sit down with a therapist, right?
Yep.
Anytime you're talking to a therapist, they're basically looking for fallacies of thought and to get neuroplastic change to occur based on what you're thinking about. So if you're depressed or you're anxiety and you're like, okay, these are my triggers, these are the things that are going on, it works. There's a place for it, right? So imagine you're going up this mountain, and therapy, you're crawling up the mountain, climbing, and you're trying to get to this certain point. With ketamine, basically, we're taking you up in a helicopter, we're dropping you off at the top of the mountain, and we're having you do therapy to stay there. Mm-hmm. And it speeds up the process. Right on. Is it the be all end all answer to all things behavioral health? Absolutely not. Is it perfect for every patient? No. But in a subset of people, it is a very effective tool for the treatment of PTSD, intractable depression, suicidal ideation. Amazing tool.
Instant. Okay, right on. If somebody was interested in that, is that something they could approach their primary care doctor about? How would they start the conversation and say, hey, I think, I've had these events in my life or I feel this way. How would they go about it, especially if they don't live here in the Treasure Coast where they'd come see you?
So
how do you start the conversation?
Start with your primary care is possible. I'm a huge advocate for primary cares doing this. It is not overly complicated medically. It is just getting education out there and doing it. I think is the more people that understand it and understand the science and the practice of it, the more people we can reach. That said, people can reach out to our office and we'll kind of put it in the show notes and whatever that we need to do, because I think what we'll end up doing is doing a deep dive into this and really explain it. Yeah, do a full episode on it, because we work with some nonprofits. We work with a lot of veterans and first responders, and it is very, we've had a lot of treatment success with it.
Yeah.
And it's the protocol and the way it's conducted in conjunction with behavioral health, talk therapy, that makes it so much better. So there's definitely, it's one of those things that there's a science and an art, and it's kind of the perfect mixture of where they combine.
So I'll sneak in my own little question here. I get a free consult, while we're on the air today. Yeah. So we talked about it for PTSD, for suicidal ideation. With this neuroplasticity that it's creating, could it be used in other modalities from just changing your behaviors or your habits or your mindsets? Has that been explored at all? It seems like we're rewiring the brain to do the correct things.
Yes, and I would say that it is, but it's kind of a really big tool to use. So that's where you're kind of looking at it. I do think that my doctorate is in psychedelic pharmacology and stuff like this. But I see that this is going to be a horizon of medicine that is absolutely going to change. Is it like neurocognitively performance enhancing and things like that? What's that show, Limitless or whatever? Just the idea of that, is that something that's possible? Maybe. You look at the psilocybin studies about, so ketamine is making you neuroplastic. They're showing that psilocybin is actually neuroregenerative. Yeah. To improve cognitive function, and starting even using it in Alzheimer's patients, Parkinson's patients, a lot of very intriguing things. So that's one of these wait and see things that I'm thrilled about, because it's it's super cool. But there's a company that I talked to. They're venture capital and chemistry. Like, I don't know what you call it, developmental chemistry or something at USF, and they are making non-psychedelic neuroplastogens.
Okay. Right on.
So, which is super cool. Like the entire idea of it, because if you can get that effect, like, because what turns a lot of people off, like psychedelic experience is pretty scary if you're not ready for it, especially the first time you go into that. I mean, it's an interesting experience.
Yeah, my thought is if I can pop a lozenge or hit a nasal spray and start like reviewing my mindset and my goals and my habits and my, you know what I mean? Like rewiring my brain, like this is what it's going to be.
No, absolutely. And do I think that's possible? I do, because I mean, I've done a lot of work in this space. It's just not something that's been studied.
Right.
Because they're looking at it for these big problems, not as like a supplement. But I mean, essentially like microdosing psilocybin that people are doing is just basically psychedelic supplementation.
A lot to come. I think we'll do a full episode on that. You know, Kris has a lot of experience, a lot of patience. I think you can share a lot of really good stories on.
Yeah.
So cool. All right. Well, we got to keep moving here. This one was submitted anonymously. It says, my wife is entering menopause and is really struggling with hot flashes, poor sleep, extreme mood changes. What should she be asking her prescriber about or considering to help alleviate symptoms? Menopause.
So
Affecting the men.
And
the children.
So that's an interesting one, because like what happens is women, my experience with, you know, female hormone treatment, you know, like HRT for females, until they're actually through menopause, the menstrual cycle's still getting a vote.
Yeah.
So you're looking to fight this wave of whatever, but everything in that is progesterone estrogen ratio, testosterone balance, and balancing it out. The easiest patients are women that are actually done with menopause, because then you're like, okay, here you go. It's like treating a dude.
Yep.
You know, you're like, you don't have a cycle that's getting a vote. So you're like, okay, this is your dose. Here you go. That said, I guess the things that I would absolutely look at, you know, you can start as a blood test as a baseline. Tissue testing needs to be your secondary test after you start the medication, if you start it. The commercially available options are not tailored for dosing specifics, right? You know, so that's the hard part. But I mean, really, it just comes down to patients working with a provider that understands the medicine and knowing that hormone replacement is not a light switch. It's like a 60-day use of the medication to see where your baseline is. And then every time you do a dosing change, it's another 60 days. So it's not a fast process.
Yeah. And we see a lot of these patients at the store, you know, kind of pre-HRT and post-HRT. And my heart goes out for some of these gals. You know, I remember talking to one, it really impacted me. You know, we were kind of pulled her off to the side and we were talking about it. She was just starting and she started breaking down crying. And she's like, I just want to be a good wife.
Yeah.
She goes, I don't want to be all over the place. I don't want to be happy one day. I don't want to be sad one day. Just want to be a good wife. I want to be a good mother. Like, she's dying for help, you know, and what we see typically, you know, is typically some amount of progesterone to be added, just like you had mentioned, right? The typical 100, 200 milligrams commercially available. Not a huge fan of those. They're like soaked in peanut oil. So it's like going and putting your drugs in the fryer at the local McDonald's and then eating them. It never quite made sense to me why they did that. But if you have a good compounding pharmacy, of course, you can get custom doses. So the doctor will look at your weight, he'll look at your symptoms, he'll look at your hormone pattern, and then will typically prescribe either something topically or orally. And that really comes down to symptom relief at some point.
And absolutely. And I think like it's getting that ratio right. And what I find with getting someone on the oral progesterone, you can get symptom release faster.
Yep, 100%.
You get symptom release faster, which is what a lot of women are looking for. Like, I'm getting hot flashes and I'm getting this right. Once that ratio is right, it's big improvement.
Yeah.
And then as far as the cognitive stuff, I mean, there are a lot of cognitive changes during menopause that actually settle out once menopause is over.
Yeah.
And that's the thing that I get a lot of those complaints too from my patients. Like, I feel like I'm going crazy in this. It's like, you're not. It's your hormones are getting a vote and they're making your brain all over the place.
Yep.
And what's interesting is you get women, they're like, I'm more angry. It's like, well, your estrogen, progesterone are tanking. Your testosterone is now physiologically high.
Yep.
So you're basically pissed off like a dude.
Yeah.
Like, 'cause you got high testosterone. So
Yeah, absolutely. So there's a lot to dive into. I think perimenopause is probably like the most, like Kris said, the most difficult time to treat women. There is relief in it. I will say it's not perfect, and you're going to keep making adjustments. So, my understanding is like in those perimenopause years, your estrogen is like it's going up and down, and it's trying to get a couple more ovulations out, right?
Yep.
The body is geared to reproduce,
Yep.
right? And we're running to the end of the life cycle of the ovaries, but it is doing everything it can, surging estrogen multiple times per month
Yep.
now, just trying to get an egg, right? To pop out. And so it's those big swings from high estrogen to low estrogen that's throwing things off in the hypothalamus. It's been a long time since pharmacy school. But anyways, if you can do a low level of estrogen, sometimes you can even out the roller coaster a little bit.
yeah.
And then to Chris's point, the oral progesterone can be really helpful in symptom relief, and it can help you sleep at night. Probably the number one
exactly.
thing that women love about progesterone. Not only is their mood a little bit better, but it will help them to sleep at night. So 1 to 200 milligrams.
It's almost the first thing. Like if a woman comes in with insomnia, it's like, let's try this first.
Yeah.
Like way before anything controlled. It's like, let's just check your progesterone level, because if we bump it back up, sleep like a baby.
So I was at a conference in Nashville, I don't know, a couple months ago, and I was talking to an ER doc, and I won't say his name. It's not necessarily appropriate, but this guy literally just keeps progesterone in his car. And so he'll be at dinner parties or the restaurant or wherever it is. And when his wife starts getting bitchy, he will literally just open it up and you're going to take your progesterone, baby, or he'll hand it out at parties. Like, here, take your progesterone, you'll feel better. So it's definitely the feel-good drug.
Yeah.
But that would be the recommendation. There are a lot of good HRT prescribers out there. I think there's a lot of people that are just dipping their toes in it too. So I would definitely interview your PCP, reach out to Emerald, reach out to Perkins or Butterfield's, or even if you're somewhere else in the country, if you reach out, we might be able to get you connected with a good practitioner in your area. So, all right. Let's see here. Moving on. So kind of, I guess, a personal question for us. What prescription therapies and supplements are currently part of your personal healthcare stack?
All right. I'll
go first?
Yeah, I'll go jump in on this.
Show yours?
Yeah. I got it. Sure. So, everybody knows, like, Amir and I, T1RX is our brand.
Yep.
We're doing it. So this is how the brand came along from this. Every supplement that I was getting my SF guys on, or I was taking, we kind of pulled together in a supplement stack. It was Amir, myself, and our medical director, Dr. Augusto. And we're like, okay, we've got all of these operator dudes on all this stuff. What are they actually taking? What are we getting the best out of? And that's what we made out T1RX. So I'm taking everything that's up here I'm taking right now, plus methylene blue,
You're taking methylene blue to Tadalafil creatine combo.
Yep, and then I'm also taking the my own HRT dose, which I'm on 0.4 twice a week, is what I'm at right now, and that keeps my testosterone levels at about 750 to 850, which is where I feel the best, and I don't get any acne, mood swings, all that. I'm plus or minus on an estrogen blocker, depending where I'm at. Like I'm taking half of one about every 5 days. This is all I need, just to knock it down a little bit, just down a little bit.
And so that's anastrozole.
Anastrozole is what I'm taking.
So essentially, just it prevents the conversion of testosterone over to estradiol, keeping everything in a perfectly balanced level.
And at that balance level. What did I find from doing this? Like, why am I doing it? For me, I would get my testosterone levels checked while I was on active duty pretty regularly. During COVID, there's a few things that happened. So one, I've got a history of TBIs. I've got some PTSD issues. I was absolutely, always alcoholic, but I was a pretty significant alcoholic, whereas messing with stuff, my levels dropped over a course of 13 months from like 750 naturally to about 410, and I felt it. So what has it given me? I've got, I'd have way less joint pain. Muscle mass is coming back, burning fat. There's absolutely a cognitive function component to testosterone. So all of that. The supplementation is just that. Like I just talked about it before. My diet is better, but it's still kind of, whatever. Yep. So the supplementation is just for that. The creatine that we add to it, and the creatine and methylene blue. For me, I'm very much if the studies make sense to me and it's something that's out there, I'm going to try it because I don't like I'll give it a shot. I feel cognitive improvement at 10 grams of creatine a day with the methylene blue. And my methylene blue, I do 60 days on, 30 days off is what I'm doing now. And that's what I'm doing. I feel really good doing it. I get my labs done regularly. My cholesterol is a little high, but it's always been a little high, so I don't really mess with it. But I've got my own theory about statins and other stuff. And right now I feel pretty good as far as my workouts and everything else.
Yeah. So my stack's not completely different. We had a lot of cross overlap. Currently right now taking 25 milligrams of enclomiphene per day. Done TRT in the past, felt good. Really just need to get in for another appointment and get set up again. But the enclomiphene's been really, really well. I've done some saliva testing, blood spot testing, running about 900 on enclomiphene, which is pretty good. Typically, and I have no desire to have, not that I don't have a desire to have more children. I have no plans to have any more children. But a lot of times in younger guys, we'll use enclomiphene because it can maintain fertility. For me, I just really wanted to see if I could, legitimately boost testosterone levels without taking TRT. So utilizing my body's own natural production. So that's been
an interesting thing with patients. Now that we're running enough patients on enclomiphene versus TRT, there are some people that are definitely hyper responders.
Yeah. Tell me about it.
So I've got a few patients, like you'll get them and you're like, okay, enclomiphene's going to take you here. And then there's these outliers. They're on enclomiphene and they'll be at like 900, 1100 on enclomiphene. No injections at all, but that's probably about every 10th patient. But it is there's definitely some people that respond to it.
I'll say my levels are definitely, they're about consistent on both. Honestly, I felt a little bit better though, taking actual testosterone.
Yeah.
I feel pretty good on both, honestly, but I think there was a slight edge to doing the injections. But like everything we do in dispense, like to kind of try it out, see how it feels. How does it affect my labs? What are the consequences? Are my lipids going to go out of control? So, above and beyond that, yes, take the multivitamin every day, War Shield Essentials. This is kind of the complete deal. It's got, bioavailable, activated B vitamins. That's super important, especially if you don't know your genetic status. Probiotics, omegas, kind of an all-in-one supplement. Creatine in the morning too. I just do 5 grams. I don't mess with it too much. I think I have an hour drive to work, and I'm afraid I have to go to the bathroom if I
take too much
creatine. So I just stick to 5 grams. I got a little bit of green powder I'll add in there too. Magnesium in the evening. Mag Change, has been like the number one selling product of all time for us. Triple magnesium blend. It was like the original home run.
It was that is a hit. That got me off prescription sleep meds.
Yep.
Period in the story.
And then
prescription sleep meds.
Yeah, sleep meds. Speaking of sleep meds, we also have Sleep Shield. So I'll do this maybe 3 times a week. Like if I just need to get deep, if I had 13, 14-hour days and need deep sleep, that is a gem. I got people using it every night and they continue to rave about it, continue to sell out. And it's all natural, right? So valerian, melatonin, GABA, and L-theanine, just in a highly absorbable mixture. So above and beyond that, I will do some additional omegas, from time to time when I think about it in passing, when I fill up my cool T1RX case like that. And I just started a new liver support supplement. So something that's kind of more just R&D right now for T1RX, focusing on N-acetylcysteine, glutathione, alpha-lipoic acid, milk thistle. If I'd had any irregularities in my labs, as you know, right, it was really around liver enzymes. So just seeing what I can do to regenerate the liver. So that's my stack. I also take methylene blue and tadalafil. And then also within that, there's a little bit of minoxidil, right? Just to kind of promote some hair growth. And then I will do a topical hair formula as well with copper peptide, GHKCU. That's my personal stack. It's always evolving, right? It's always changing, but you're always going to have those core components. You're going to have a really high quality multivitamin. You're going to have vitamin D, probably magnesium at night, and then, obviously the hormone support. So,
if I went off everything else, the only thing I would not give up is the mag change. Like I was like, father, like that was such a big deal for like my sleep quality. Like I was absolutely convert to the whole magnesium thing after that. I was like, how important could that be? I was like, oh wow, it's pretty freaking important.
Sleep like a baby every night on that. Interesting enough, on the, I told you guys about breaking my nose and all the bleeding, and there was progressive bleeding throughout the week too. I stopped everything. Everything. Half of it was I was just, hanging in bed. And I know like some of the stuff around the fish oil and whatnot it can make you prone to bleeding. So I stopped everything 100%, and I finally started back this Monday. What a difference! Like supplements you can feel has been really good. So, all right, Kris, I think it's all the time we have today. We are definitely going to do a part 2 on the Q&A. It's been fun. I appreciate you as always. Follow us, Dose Adjustment Podcast, on anywhere you can see podcasts. We appreciate you guys. And don't hesitate to drop us a comment or reach out to us at the office. We're here to help.
Thank you.
Have a good day, guys.
The information provided in this podcast is for educational and informational purposes only, and it does not establish a physician-patient or pharmacist-patient relationship. The opinions expressed by the hosts and guests are their own and do not constitute medical advice. This content is not intended to diagnose, treat, cure, or prevent any medical condition. Always consult with a licensed healthcare provider in your area before making any changes to your personal healthcare regimen or acting on any medical information shared in this podcast.